Chimpanzees have been used for medical testing for decades. The last developed country to allow the practice, the US, is about to outlaw it as unnecessary and inhumane. But now a study by a group of leading primate researchers says testing should continue, not for the benefit of human health, but to save wild apes. Ebola killed thousands of chimps and a third of the world's wild gorilla population in the years up to 2007. And for those apes coming into contact with humans, it's estimated around half their deaths are due to human cold and flu viruses. Well, now a vaccine tested and effective in captive chimps could save many in the wild. Without testing on captive chimps, researchers say this would not have been possible. Well, earlier I spoke to Peter Walsh, a lecturer at the University of Cambridge and the study's lead author.
I understand why people want to protect the chimpanzees in captivity, but the consequence of shutting down the testing in captivity is going to be very bad for chimps in the wild. It's going to push them closer to extinction. Infectious disease has become a huge problem for gorillas and chimpanzees in the wild. It's one of the three big factors that's pushing them towards extinction. And we have a bunch of vaccines that might protect them, but before we can use them in the wild, we have to test them in captivity to make sure they're safe. And so that's what we've just done. It's the first time it's been done. But unfortunately, the United States government is the last country that actually allows chimpanzee testing, and they're moving very rapidly towards outlawing it. And so if they outlaw it, we won't be able to test any vaccines. We won't be able to use the vaccines in the wild. And that's going to mean, just in the most brutal terms, that's going to be dead chimpanzees and gorillas.
Right.
In the short term, it's going to be tens and hundreds. In the long term, thousands.
Okay. In your report, Peter, you mention the Ebola virus, which has wiped out a third of gorillas in the wild. And in your study, you say you've developed a vaccine for monkeys, if I understand correctly. We've had recently another outbreak of Ebola in Africa. Could this vaccine be applied to humans?
Oh, sure. This is a vaccine that was developed for humans. In fact, there's 5 or 6 other vaccines that have also been successful in protecting monkeys in captivity. They just haven't been licensed for human use yet. But there are a bunch of vaccines out there. It's just a matter of money, getting the money to go through the licensing process.